Hello, everybody. We're going to do the last lecture in the heart unit. So we will be finishing up after today, and this one is pretty short. So it won't take us too long to just run through some common clinical issues that you will see in the cardiovascular system. And this will just be an overview, not a lot of detail about each one. I've put a link to this flip chart on Google Classroom, and you can just scribble down some notes on those papers if you have a printer. If not, I would just kind of listen closely, maybe jot down a few names and descriptions, and then see if you can complete the review sheet that's also on there. So this is just an overview. There won't be a lot of pathophysiology in this one. All right, so the first one of the clinical issues that we're going to talk about is angina pectoris. And just based on that name, you would think pectoris, that has to do something with the chest. And angina just means generalized pain. And this pain is a temporary chest pain. Sometimes it can be experienced as pressure or discomfort, an uncomfortable feeling in the chest that can be due to a lack of blood supply to the myocardium. And if the heart is continually working and you decrease that blood supply, you can experience pain, you can experience a tightness, sometimes a burning or pressure within that center section of your chest or the medial portion of your chest cavity. You may have that pain radiate up into the shoulder. Sometimes it'll radiate down the left arm, but not always. In females, it's common to experience that pain in your back versus in your chest. And it does not mean heart attack. Okay, so this is not a heart attack. This is pain that you experience from a decrease in blood supply to that myocardium. There are two types of vascular problems that we'll talk about, and one is a type of the other. Okay, so atherosclerosis is a type of arteriosclerosis. So the top one is a type of the bottom one in this picture. And we'll start with arteriosclerosis. Arteriosclerosis has to do with just overall hardening of the blood vessels, typically an artery, but not always. It is a common problem with aging. It's just a normal aging of the vessel, just like we get aging of other parts of the body. And this thickening can cause damage or inflammation inside of that vessel and can lead to atherosclerosis, which is where there is a tear or damage in the wall of the artery, and it's a spot for a fatty buildup or a buildup of adipose tissue inside the vessel. So there is a reduction in the size of the lumen, and the artery will become narrowed and can potentially become blocked by a blood clot. Not always, but over time, if you decrease the inner surface of that lumen with fat buildup, not only is it changing the diameter, the inner diameter of that artery, but it can also change the surface of it to where it's typically a smooth endothelium, and now it is sticky fat. And a clot can build up there and occlude the artery or cut it off to where you don't get any blood flow downstream from there. It can cause other issues with peripheral artery disease, where it can interfere with the arteries of the legs and the periphery of your body and cause some unwanted side effects with that. But this is just a common blood vessel disease. Since the vascular system is part of the cardiovascular unit, I'm going to put that in there. The way to fix this is to reduce cholesterol levels. You want to keep your cholesterol levels down so that the cholesterol or fatty substances cannot build up inside that artery. You also want to, if you're showing symptoms of the athero or arteriosclerosis, get it checked out with either vascular ultrasounds or typically if it's on the vessels of the heart, you would want to have a stent put in or keep a watch on the percentage of those arteries that are blocked so you can provide as much oxygenation as possible to that myocardium. The next one is a heart attack, okay? And a heart attack can cause angina pectoris, and it should, okay, because it should cause chest pain if this is occurring. But the actual term for a heart attack is a myocardial infarction, okay, F-A-R-C-T on that word. Myocardial just means the muscle of the heart. If you do get a plaque buildup, if you do have fat building up in the inner diameter of that artery and it completely occludes or blocks off the blood supply, then there will be no oxygenation to the myocardium downstream from that blockage. And if you block off blood supply to the myocardium, then clearly it's not going to contract. We cannot get the cardiac conduction pathway to travel through dead muscle tissue. Therefore, it will not work. It will not contract, and therefore areas of your heart may not beat. The area that is starved of oxygen due to this plaque buildup and due to a poor oxygenation or no blood supply is called a zone of ischemia. And ischemia just means a lack of oxygen. And depending on where and how much of that myocardium is starved of oxygen or how big the zone of ischemia is, you can have very minor heart attacks or you can have massive heart attacks that you don't recover from. So if we were to occlude the artery way up here in the right ventricle and you starve this entire area that looks purpley blue here, then that muscle will die. And therefore it will not beat, and you'll either have a drastically reduced stroke volume in the heart, or if it's bad enough, then the heart will go into fibrillation and will stop. If it's just a minor area of ischemia, then you may not even know that it happened, or they can go in and open up the blockage and open up that blood supply and resupply that area of the myocardium with oxygen. Then you can't regain, but you can hopefully reduce the side effects of that myocardial infarction. And so the thing to do is to act fast. If they can get you into the cath lab and they can get a stent put in and they can reopen that pathway, then the quicker the better. All right, congestive heart failure is kind of near and dear to my heart. And it is a horrible disease to watch happen. But congestive heart failure is due to a weakening of the heart muscle. And as the heart muscle weakens over time due to untreated or just bad cardiovascular disease, bad heart disease, you can get other side effects such as ascites, which is swelling in the abdomen. It gets kind of this pot belly appearance, pulmonary effusion, which is where you have excess fluid around the lung and therefore the lung cannot inflate, which leads to coughing, tiredness, shortness of breath, and then swelling in the ankles and legs. And sometimes the swelling can be normal coloration, so that the legs don't appear different in color, and sometimes the swelling can lead to purpley pink colors in the distal portions of someone's legs. My grandfather had congestive heart failure, and we probably knew but didn't know all at the same time, and he definitely didn't believe in doctors and thought that he shouldn't go, and so it went untreated for a very, very long period of time. He ended up having a triple bypass in his heart where they bypassed 3 of his coronary arteries at one time due to high cholesterol and blockages. And he never recovered from it because his heart muscle by that point was so weak that it could not pump hard enough to remove the excess fluid from his blood and his kidneys. And so the cardiovascular system and urinary system are intertwined in that proper level of blood pressure and that stroke volume and the force of heartbeat is going to remove excess fluid from the blood, and you excrete that as urine. Well, after his surgery, he did not make urine for a long time because his kidneys just, as I said, they're so intertwined with the heart. His heart was weak, his kidney couldn't do the function, and so the fluid had to build up somewhere. It's, it just doesn't go away or disappear in the body. And so it built up around the lung and specifically in his legs. His legs were huge, and they would even bead water, what looked like water, tissue fluid out of his skin. And his feet were wet. And I said, what's going on? Why are your feet wet? He had no idea. But because the heart was weak, the fluid would just pool in areas where gravity takes a hold, and it literally pulled it out of the skin. And he passed of a blood clot to the heart because there was a blood clot hiding in all of that excess tissue fluid and traveled to his heart, and he passed. But, I'm not saying that to tell y'all to be sad and all that. It is really a way to teach y'all to be proactive about your cardiovascular health, for me to be proactive about cardiovascular health and make sure that if I know I have a family member with this, then I need to be on the lookout for the signs of it early, or for the signs that lead to cardiovascular disease and congestive heart failure and end stage congestive heart failure. So anyway, it is a widespread problem in America. So just be careful with it. And if you know loved ones that have it, then make sure they're going to their checkups, because it can really prolong their life if they stay on top of the treatment for it. All right, varicose veins. So varicose veins are a disorder of the vein, not the artery. And it can appear as these ropes under the skin and this lumpy appearance under the skin, or it can appear as dark vessels. Sometimes people call them spider veins underneath the skin. Spider veins don't always mean varicose veins, but if they're large, like in this picture, then it's typically a varicose vein. If you remember back to the blood vessel lecture, veins are the lazy river, okay? And 60% of your blood volume is just hanging out in those veins until it returns to the heart. Well, in order to stop it midway through, or in order to move blood a small distance and then hold it where it is, and then move it a little bit further and hold it where it is, they have valves in them. And remember, if the valve is functioning properly, the blood will travel a bit, and that valve serves as a swinging door, and it catches it. And you go a little bit further, and it catches it. In varicose veins, those valves become leaky, and you get kind of this pooling of blood around the valves. Sometimes the valves can even harden, and when there is a pooling of blood or an extra collection of blood around that valve, it can cause this ropey appearance. It's painful. You can get them anywhere in the body. A lot of people who stand a long time for their job are more prone to varicose veins. Pregnancy can cause some increased risk of varicose veins. Genetics can cause an increased risk, and so the best thing to do is to treat them early. But also, if you stand for long periods of time, I have two roommates from college who are both pharmacists, and they stand all day. And so they wear compression tights under their work clothes to help compress on those veins and help compress on those muscles around those veins to help the activity and efficiency of those valves. They can go in and treat them with lasers. They can go in and treat them with injections to help with some of the side effects of them. But again, they're more common in the lower extremities and in the more distal portions of your legs because they're under the most stress to get that blood back up to the heart. All right, an embolus versus a thrombus, or an embolism versus a thrombus. A thrombus is a stationary blood clot, and a stationary blood clot means it doesn't move. It is hanging out in a blood vessel, and sometimes it can get hung in the valve. Sometimes it can kind of stick to the wall. of the vein or the artery. Most of the time it is in a vein. And when it starts to travel, you just change the name from a thrombus to an embolism. And an embolism is a blood clot on the move. And that means it's probably going to stick somewhere. And you don't want it to stick in the lung, and you don't want it to stick in the heart, and you don't want it to stick in the brain either, because that can cause a potential stroke. It could cause a lung to collapse or shortness of breath, or it could even cause the heart to stop. Because if it clogs one of the arteries or blocks one of the arteries that supplies the myocardium with blood, then the heart doesn't have that blood anymore, and therefore it can stop the contraction. So things to be on the lookout for are DVTs, which are deep vein thrombosis. Normally they're found in the lower legs, and it will start out as just a little bit of pain in your lower leg, typically kind of in the base of the calf or behind the knee. And then a day later, it's super sore, normally red, hot to the touch. You can barely put your foot down, and you go to the hospital or doctor. They send you in for an ultrasound and see that you have a deep vein thrombosis. Sometimes it can be due to medications that you take. Contraceptive medications are prone to causing DVTs. Other things like hormonal supplements, I should say. If you have a DVT, they can also be coming from an underlying blood clotting disorder that you may not know about until you have your first one. And in order to treat it, they might put you on blood thinners for 6 months or so to make sure that you don't get one again. If you have an embolism and it travels to your brain or it travels to your lung, they're going to make sure that you can regain your lung capacity and that you're able to breathe. If it is in your brain and causing stroke-like symptoms, then they can give you a medication that's commonly called a clot buster to bust up that clot. But typically a DVT, the T is a thrombosis, and it is stationary. So again, it's not as scary until it becomes an embolism and it's on the move. Okay, an aneurysm, we got 2 more. So an aneurysm is a ballooning of the artery, and the scary thing is sometimes you don't know you have one until they kind of accidentally stumble on it based on other medical imaging that they may be doing for some other issue. But it is where the wall of the artery becomes weak. And if the wall is weak, as it's under constant pressure from the ventricular contraction, it can cause it to balloon out and become weaker and weaker. And thankfully, vascular surgeons and cardiovascular people know the correct diameters of the arteries that are common for aneurysms, and they know the scary diameters that you need to have surgery for. And so if they discover an aneurysm, then they will keep a close watch on it until it reaches the scary diameters, and then they can go in and perform surgery to prevent a ruptured aneurysm. A ruptured aneurysm in the brain can cause stroke symptoms. A ruptured aneurysm in your aorta can cause massive blood loss, since that's the biggest one in your body, and can lead to death if not treated almost immediately. It can also be surgically fixed if you know you have it and you continue to watch it for a growth over time. And so they'll go in and put a graft inside this is an aorta example. So they take an area above it and they clamp, and they take an area below it and they clamp. They cut open your aorta and they kind of lay it out. They put a graft in and they wrap your aorta back over that graft, and that stabilizes the weakness in the wall. So it's almost like a balloon, and you're trying to make a balloon animal, or you've got a balloon and you're playing with it and you squeeze it and a portion of it kind of bloops through your hands. That's what the aneurysm is. All right, and the last one is a stroke. And a stroke is basically a brain attack versus a heart attack. And it can be caused from an atherosclerotic clot, so where one of those plaque builds up over time in an artery in your brain, or it can come from a blood clot that may be stationary, may be a thrombosis in the brain, or it could be an embolism that traveled to the brain and occluded one of those arteries, or it could come from an aneurysm that ruptured and you have a hemorrhage or blood pooling on the surface of the brain. And the thing to do is to really act fast. And if you have symptoms of a stroke or you're around somebody that has symptoms of a stroke, to go ahead and call 911 immediately, because the quicker you act, the better. And they can give you clot busters, or they can release the pressure from a hemorrhage, or they can come in and try to clear out some of the clot, atherosclerotic clot that's causing the symptoms. I would always ask my patients in the ER, can you smile? And if they smile and they had one side of their mouth would move and the other one wouldn't, then I knew that the stroke was on the opposite side of the brain. Or can you squeeze my hands? If they had limited motor ability, can you raise your arms? Can you wiggle your toes? What are the symptoms of it? If you stick out your tongue, the tongue's going to go to one side versus the other one. If they're having a stroke, they may have slurred speech, they may have blurred vision. They may be a little bit out of it and not be coherent, or be kind of talking a little bit gibberish. They may not be able to talk. And so if any of those symptoms come up, then it's best to go ahead and call 911, because again, think fast. The quicker you act, the better. All right, so that finishes up the cardiovascular unit. Yay. We'll do nervous system next. And if you have any questions, just let me know.